Welcome back, guys. Let me continue thanking you guys for the subscription and the support you are showing me, and I always appreciate your support. I can't take it for granted. So guys, as we continue this long journey of educating you guys, let's continue sharing our videos, let's continue sharing our content, as I know and I'm pretty sure it will help your sister, your brother, or your relative. So let's get back to our point of discussion, whereby we are discussing about neonatal sepsis, and in this video we are going to discuss about the complications or what will happen if this kind of a condition is not managed in the right way and at the right time. So what are the complications which the child can develop as a result of neonatal sepsis? So one, we have what we call infant death. Infant death. This means this disease can cause death to the infant. So in infant death, you find that in term and preterm infants, mortality from neonatal sepsis has been estimated at around 4%. This is the rate at which children or infants are dying. Mortality means death. So simply, this means the percentage or the percentage rate at which these children are dying from this kind of a condition is estimated at 4%, which is a very, very high percentage. So what doctors, all healthcare professionals should be in a position to diagnose this kind of a disease earlier enough to prevent this kind of infant mortality or death. The other complication is what we call meningitis. What is meningitis? Meningitis simply means inflammation of the meninges or the membrane that surrounds the brain. And when this one occurs, the child may start having things like seizures or convulsions. The next point, we have what we call developmental delays or what we call delayed milestone. So you will find that the child growth and development is impaired or it's very slow, and this is because this kind of a disease mostly affects the brain, and the brain is the control center of everything in our systems. The next point, we have what we call cerebral palsy. We have seizure disorders. This is whereby you will find that a child has a condition whereby from time to time the child will have twitches, the child may also faint, the child may also have convulsions. Next point, we have hearing loss. This means this kind of a disease, if left untreated, can lead to deafness or hearing loss. There is another point people have been asking more and more questions about. So let's talk about a bit. Let's take a minute or two and know what is neonatal sepsis and birth injury. First of all, what is birth injury, or what does it mean by a birth injury? Birth injury is any type of harm. Simply, injury means a harm to your body. So birth injury is any type of harm to a baby occurring, not this, any type of harm to a baby occurring shortly before birth, during, or in early infancy. Any type of harm to a baby occurring shortly before birth, during birth, or in early infancy. So, what are the complications? Or what are other complications as a result of sepsis or health conditions and disabilities? So let's see some other complications. We have discussed about a few above. And now I want us to see other complications as a result of neonatal sepsis or health conditions and disabilities as a result of neonatal sepsis. One, we have what we call septic shock. What is septic shock? Septic shock means dangerously low blood pressure. Dangerously low blood pressure. Number two, we have what we call apnea or bradycardia. This is simply means problems in respiration. Number three, we have respiration distress or difficulties in breathing. We have feeding issues. This child will be having problems in breastfeeding or feeding. The next point, we have encephalitis. Encephalitis, or it all depends with where we have been born. Some people can call it encephalitis, others can call it encephalitis. This simply means inflammation of the brain. Inflammation of brain that can lead to lifelong disabilities. Encephalitis, I repeat again, encephalitis or encephalitis, whichever, it simply means inflammation of brain that can lead to lifelong disabilities. And some of the examples of these disabilities are what we call cerebral palsy or epilepsy. This marks the end of our discussion and the end of our discussion on neonatal sepsis. And guys, as I have been saying, if you have a topic that you want us to discuss, you can simply DM me, or you can put it in the comment section and we'll be in a position to assist you. Guys, thank you for your time. Thank you for your subscription. For the returning subscribers, thanks a lot. Let's continue sharing, commenting, and this channel will be a success. Thank you for your support. I do appreciate very, very much. Have a nice evening. Goodbye.